Greetings, curious minds. Welcome to Brainetainment, where we make learning a fun and engaging experience. Our aim is to provide you with accessible, high-quality educational content that's as entertaining as it is enlightening. From the mysteries of the cosmos to the cells in our bodies, there's always something new to learn and explore. So buckle up, because knowledge is the greatest adventure there is. Today, we delve into a topic that affects millions worldwide: diabetes. Diabetes, a term we often hear, but what exactly is it? Well, let's start with the basics. Diabetes is a chronic health condition that affects how your body turns food into energy. When you eat, your body breaks down most of the food into a sugar called glucose. This glucose then enters your bloodstream, and your pancreas, a small organ tucked behind your stomach, releases a hormone known as insulin. Insulin acts like a key, allowing glucose to enter your body's cells where it can be used for energy. Now here's where diabetes comes into play. In people with diabetes, this process doesn't work as it should. There are a few different types of diabetes, and they all involve issues with insulin. First, there's type 1 diabetes. This is an autoimmune condition, which means the body's immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. As a result, the body produces little to no insulin. People with type 1 diabetes must take insulin every day to stay alive. Then there's type 2 diabetes. This is the most common type, affecting about 90% of people with diabetes. In type 2, your body either doesn't make enough insulin or doesn't use insulin well. Over time, the pancreas can't keep up with the demand to produce more insulin, and glucose builds up in your bloodstream. Lastly, there's gestational diabetes, which develops in some women during pregnancy. Most of the time, this type of diabetes goes away after the baby is born. However, a woman who has had gestational diabetes is more likely to develop type 2 diabetes later in life. In essence, diabetes is a condition where the body either can't produce insulin or can't use it properly, leading to high levels of glucose in the blood. This can cause an array of health issues if not managed effectively. So diabetes is more than just high sugar levels. It's a complex condition involving insulin and our body's cells. You might wonder how diabetes affects our body. It's a good question, and we're going to answer just that. When we talk about diabetes, it's essential to understand that it's not just about high blood sugar levels. It's about a malfunction in our body's ability to use and store glucose, a type of sugar our bodies use for energy. This malfunction can lead to a chain reaction of complications across various body systems. Let's start with the cardiovascular system. Diabetes can cause a buildup of glucose in the blood vessels, leading to a hardening of the arteries, a condition known as atherosclerosis. This can increase the risk of heart disease and stroke, making it a serious concern for those living with diabetes. Next, let's move to the kidneys. High blood sugar can overwork these vital organs, causing damage over time. This can lead to kidney disease or nephropathy, which might necessitate dialysis or a kidney transplant in severe cases. But the effects of diabetes don't stop there. It can also have a significant impact on our eyes. Diabetes can damage the blood vessels in the retina, the part of the eye that senses light. This condition, known as diabetic retinopathy, can lead to vision loss if left untreated. Finally, let's discuss the nervous system. High blood sugar levels can cause damage to the nerves throughout the body, a condition known as diabetic neuropathy. This can lead to a range of symptoms, from tingling and numbness in the extremities to problems with digestion, urinary tract issues, and even heart rate abnormalities. So, in essence, diabetes doesn't just affect one part of the body. It's a systemic issue that can lead to a multitude of complications if not managed properly. As you can see, diabetes has a far-reaching impact on our body, which is why managing it effectively is crucial. So, how can one manage blood sugar levels effectively? This is a question many of us ponder upon, especially those dealing with diabetes. Well, worry not. We are here to provide some practical tips that can help you maintain your blood sugar levels effectively. Let's start with a no-brainer: maintaining a balanced diet. Now, this doesn't mean you need to completely revamp your eating habits overnight. Rather, it's about making mindful choices. Incorporate foods that are high in fiber and low in sugar. Whole grains, fruits, vegetables, and lean protein should be staples in your diet. On the flip side, try to limit your intake of processed foods and sugary drinks. Small changes like these can have a big impact on your blood sugar levels. Moving on, let's talk about regular physical activity. Engaging in regular exercise helps your body use insulin more efficiently, which can lower your blood sugar levels. Whether it's a brisk walk around the block, a dance class, or a game of tennis, find something you enjoy and stick with it. Remember, it's not about how intense the activity is, it's about consistency. Aim for at least 30 minutes of moderate physical activity most days of the week. Next up, we have regular monitoring of blood sugar levels. This is crucial in understanding how different foods, activities, and even emotions affect your blood sugar levels. Regular monitoring can provide you with valuable insights into your body's response to various factors, helping you make informed decisions about your diet, exercise, and medication. It's like having a personal guide to your diabetes management. Speaking of medication, adhering to your prescribed medication regimen is crucial. Medication, whether in the form of pills or insulin, plays a key role in managing blood sugar levels. Make sure to take your medication as prescribed by your healthcare provider. And remember, don't hesitate to reach out to them if you have any concerns or questions about your medication. Lastly, but equally important, is managing stress. High stress levels can cause your blood sugar levels to rise. Therefore, it's important to find healthy ways to manage stress. This could be through meditation, yoga, reading, or even just a quiet walk in the park. In conclusion, managing blood sugar levels effectively is a multifaceted approach. It involves a balanced diet, regular physical activity, diligent monitoring of blood sugar levels, adherence to medication, and stress management. And while this might seem like a tall order, remember that it's about making small, manageable changes to your lifestyle. Remember, managing diabetes is a marathon, not a sprint. It's about making small, sustainable changes to your lifestyle. So take it one step at a time, and before you know it, these changes will become a part of your routine, helping you lead a healthier and more balanced life. Let's quickly recap what we've learned about diabetes. We started off by understanding what exactly diabetes is. It's a chronic health condition where the body is either unable to produce insulin or it can't utilize the insulin it produces effectively. This leads to high levels of sugar in the blood, which can cause a host of health complications if left unchecked. We looked at the two main types of diabetes. Type 1, often diagnosed in childhood, where the body doesn't produce insulin at all, and Type 2, the most common form, where the body doesn't use insulin well. We also touched on gestational diabetes, which can occur during pregnancy, and prediabetes, a condition where blood sugar levels are higher than normal but not high enough to be classified as diabetes. Next, we dived into how diabetes affects the body. From the eyes to the heart, from the kidneys to the nerves, high blood sugar can wreak havoc on your body's systems. It can lead to vision problems, heart disease, kidney failure, and nerve damage, among other things. It's a serious condition that requires careful management. And that's where our tips for managing blood sugar levels come in. We discussed the importance of a balanced diet, regular exercise, and maintaining a healthy weight. We emphasized the role of regular blood glucose testing in managing diabetes and the significance of medication if prescribed by your healthcare provider. Lifestyle changes can have a significant impact on managing diabetes and preventing or delaying complications. We also highlighted the importance of regular checkups with your healthcare provider. Regular screenings can help detect diabetes early and start treatment promptly, reducing the risk of severe complications. In conclusion, diabetes is not just a disease, but a lifestyle condition. It's about making choices every day that will help manage your blood sugar levels and maintain your overall health. It's about understanding your body and its needs and responding accordingly. It's about taking control of your health and living your life to the fullest, despite diabetes. Remember, knowledge is power. The more you know about diabetes, the better equipped you'll be to manage it effectively. It's a journey, and it's one that you don't have to walk alone. Reach out to healthcare professionals, support groups, and loved ones for help and encouragement. And that's a wrap on our deep dive into diabetes. Don't forget to subscribe to Brainetainment for more enlightening content. Stay curious, stay healthy.